So let's look at some of the current information, some of the numbers, the statistics that we deal with this particular population. Let's think about this number. 11% of veterans who visit a medical facility that's run by the VA for the first time have a substance use disorder. Now, that's a high, significant number. 11% of veterans. So when they go to the VA, this is the ones that end up looking for help or end up being in the VA for help, for treatment. 11% have substance use disorder. This gets our attention, right? This makes us think, okay, this is an important topic. 1.111 million veterans meet the criteria for substance use disorders that we know of. That means that 4 out of 5 struggle with alcohol. That's 80% of our veterans are struggling with alcohol use disorder, AUD. That's 900,000 people. Secondly, 1 in 4 struggling with illicit drugs. So 27, 25, 20%, 27% are struggling with illegal, illicit drug use. And then 1 in 13, about 7%, they struggle with both. So this really does get our attention to say we have to address this and we need to be prepared for it in our work with who it might be as far as it goes with veterans with active duty military. Now, why is alcohol use disorder so prevalent among active duty and veterans? I've talked to veterans, I've talked to people on active duty, as well as first responders, police, but especially as for our topic today, why is alcohol use disorder so prevalent among active duty and veterans? This is something that we have to think about deeply. Look at this. Alcohol is more acceptable. Matter of fact, I remember growing up, we're in a Navy town, and so we've had Navy personnel around us all the time, all my life. You expected the guys to get drunk on the weekend and get into fights. That was just kind of the norm. And so, that's just how it was. Now, here someone saying being former Air Force, we used, our overtime weekend to get together and unwind. Sure. Your time off. It's easy to access and random. So the first one is that it's more acceptable. Alcohol, everybody drinks. I hear that all the time. I had a Navy SEAL who came in and he said, when we travel, we drink ourselves to sleep every now and then. We do a lot of other things. He said, but the problem is my wife doesn't want me to do that anymore. He said, but everybody does it. So I said, well, let me ask you a question. When you say everybody drinks themselves to sleep, everybody is drinking to that degree, literally everybody. Well, there are 2 guys that don't, but they're weird. I said, okay. I said, now you're going to have to get weird because you're to a point where neither your wife or the military are happy with you getting drunk all the time. And so you're going to have to be one of those 2 or 3 weird people that don't get drunk all the time. Alcohol is available. My philosophy has been for many years now, people use the drug that is available to them. They use the substances that are available. You can find a timeline chart throughout the years of the different drugs that have been prevalent at different times, 60s, 70s, and 80s. And then there's some drugs have been there all along. But people use what's most available. Alcohol is available. 7-Eleven's on every corner. It's easy to buy. It's affordable. It's not like some expensive designer drug where it's very expensive. And, in the military, you're not tested for alcohol. Now, in our treatment center, we use a breathalyzer when people come in. And then also in the urine tests that we do, it goes back for 80 hours for alcohol in their system. But a lot of military tell us that they never get tested for alcohol. They get tested for some of the other drugs. And one guy told me, he said, well, what else do you have? It's your social life, it's your fun life, it takes care of some of your problems. So what else are you going to do? And so with these answers and the possible reasons, we see that it is a major problem. And for our course today, I said, since alcohol is the number 1 issue, let's give some heavy focus on that. So that's where we are. Veterans with the most severe psychological or medical disabilities, for example, active psychosis, schizophrenia, bipolar disorder, spinal cord injuries, traumatic brain injuries. These are served and supported by the supported employment and were less likely to secure employment compared to veterans enrolled in other programs as transitional work, community-based employment services. So when we have alcohol on the rise and we have these other diagnoses that happen with our veterans, it creates a severe problem for them in a number of ways. But what we did find to be, really awakening for us is veterans between the age of 55 and 74 have the highest rate of completed suicides. That's pretty scary. So the adjusted suicide rate for veterans rose in every group between 2001 and 2020. So suicide has been on the rise. Now, what I do have and found is that there is somewhat, if you want to call it discrepancy or differences, we'll get to that on the next page. But if you look here, 18 to 35, 34 is the 95 percentile, 35 to 54, 13 percentile, 55 to 74, 58, 75 and up 21%. But the highest number that has completed suicide over the years has always been 55 to 74. Now, the suicide rates declined in the ethnic categories from 2019 to 2020, except the rate for white veterans was more than double that of black veterans. So that's a statistic to be aware of. As I said, these numbers kind of get our attention. One study of military personnel found that 30% of completed suicides were preceded by alcohol or drug use. 30%. An estimated 20% of high-risk behavior deaths were attributed to alcohol or drug overdose. Now, 30%. Now, here's how my mind works, and I want to see if you think this way. If 30% of completed suicides could have been avoided by substance use treatment, if we could get that 30% into substance use treatment, if they could get better from their substance use, just imagine how much less the totals could be for completed suicides. For example, in 2020, there were 6,146 veteran suicides, 17 per day. Now, other statistics tell me, and I hear this often, it was 22 per day. So giving leeway between the numbers, the suicide rate for veterans was 57% higher than for non-veterans. If there are 17 completed suicides deaths daily, and as I said, many of the people I talked to and other statistics have said up to 22. If there are that number daily, and we could get a 30% reduction if they receive treatment, that could take us from 22 to 15, or from 17 to 12 suicide deaths a day. In my opinion, that would be very significant. And so the cry that we should all have out in our practices is, bring me the veterans, let's get them substance use help, let's get them some of the principles we're going to show today that will work and help save some lives. Now, if you agree with that, let's have a hand. Just give a clap for that. Let's save some lives. That's what this is really about today. What can we do to help stop this number, help drop that down, and help save some lives? And you're commenting, absolutely. Some of you are really recognizing what we're saying. Now, suicide among veterans is a deeply concerning issue. One of the keys for veterans is homelessness. They get out of the military and they have nowhere to live, divorce and unemployment. These are predictors of suicide or self-harm. We know that. There are often mental health issues that are underlying. So quite often when your clients come to you, what happens is they may have shown up because they have a substance use disorder, and it's not the real problem. It's just a symptom of a much deeper problem. And we'll be discussing that as we go. Someone said sometimes they can't afford treatment. We need to help them find affordable treatment. And there are some serious problems with veterans who are not getting treatment. We run a nonprofit agency here in Virginia. And what we've done is we do fundraising. We give very deep discounts for veterans for active duty. They can use TRICARE, but we want our people to have access to get the help they need. Another issue with suicidal rates is mental illness. And so mental health plays a significant role. Conditions such as major depression or psychosis, self-harm, these have to be addressed as deeper symptoms, not only with the substance use issue. If they already have a medical history in their life, and so they've already had other issues that have troubled them, including things like diagnoses, treatments, previous stays in high psychiatric hospitals, use of antidepressants, stress and challenges. Now, if you have these notes on paper or any way that you can, you want to circle that one. The stress challenges that veterans face can be unsurmountable. I've interviewed veterans who have tried to get help. And what I hear quite often over and over again, it was going to take me 3 to 6 months to get in to see a doctor. Well, 3 to 6 months from now, for a veteran who is contemplating suicide, is like 3 to 6 years. And so we, particularly here, we make treatment accessible and affordable. When people call our treatment center, we're able to get them in usually within a week or 2 weeks, up to 3 at the most, depending on their schedule and ours, but up to 2 to 3 weeks or less. And we keep the costs down because we do some fundraising and we do take their insurances. But these stresses and the challenges of trying to get help, just imagine with me, I was on the phone with, I had a veteran in my office the other day, and we were trying to make a phone call to get a referral for him for something. And they put us on hold, then they dropped the call. Then we call back again, they put us on hold again. If you're just doing that yourself and you're already troubled, you're going to quit. You just say, look, it's not worth the effort. And that's what happens quite often with some of our people. So someone's asking, do you still think that it's a long time to be waiting for treatment if they're in trouble? Absolutely. Yes. And so we need to make treatment accessible and affordable. So another issue that has to do with veteran suicides is, and active duty, wellness and isolation. That is improving the overall wellness of the person, reducing them being isolated, helping them develop essential goals, helping them develop some success in their lives, independent of whether or not it reduces the suicide, but I believe it will. And so social support, mental health services play a very, very important role in that development. So consistent with the general population, alcohol and drug use disorder, these diagnoses are more common among male than females. I think it would be obvious that we would know that. 10.5% of current alcohol use disorders. Alcohol is the primary substance for 65% of veterans who enter treatment centers. And for that reason, we have got to get a handle on and a real understanding of how alcohol use disorder works and how we can work with them. Male veterans are more than twice as likely to be diagnosed with alcohol use disorder than female veterans. So we want to keep in mind that many of the estimates that are done, all of these statistics, we have to look at the statistics. Sometimes they're boring, but they do give us a snapshot of our culture. And so we have to keep in mind that many of these estimates are lumped together. They lump all the age groups despite the differences and the variations by age. A recent epidemiological study found that among male veterans, the overall prevalence of substance use was lower than rates of civilian substance use when the ages were all lumped together, examined together. But let's look at this. When looking at the pattern for male veterans aged 18 to 25 only, the rates were significantly higher in veterans than compared with civilians. So these age characteristics, once again, as we said with suicide before, 55 and up have a higher rate of suicide. So research indicates that individuals who undergo treatment for alcohol and other drug use largely have poor work histories, low employment rates, regardless of their education or vocational services. This may be an important component for their treatment. And so if we can help people get jobs, if we can help them have a sense of value and purpose, it's a very, very important indicator of more mental health. What we've done here in our location is we're partnering with a very large nonprofit in the area that what they do is get jobs for people with disabilities. So what we discovered with them recently in the last couple of years, we can now diagnose people as a disability when they have substance use disorder. So substance use disorder as a disability gives us much more help in being able to get people jobs, and being able to help veterans and active duty who are leaving the work for the military, helping them come back into society with a job and do things that will help them feel important and significant. Very, very important to what we're doing.